are talking health and wellness here on NACDS-TV, and joining me now, who better to talk about that, is Greg Wasson, President and CEO of Walgreens. Now, Greg, tell me how Walgreens is implementing this trend into its stores.
Well, I think the entire industry is, but certainly we're doing a lot of things. And one of the things we're doing, I just stopped by our pharmacist booth over there and just got my flu shot for the year. So we're advancing the role that community pharmacy can play in healthcare by trying to allow our pharmacists to be able to spend more time to do more things, such as flu shots, immunizations, and vaccinations, screenings. We're piloting a new blood draw science in our stores in Arizona, as well as just trying to make sure that we've got people available, nurse practitioners and everything that can extend the services at the pharmacy office.
Absolutely, and being able to implement that here right on the show floor is pretty neat. So what value does that add to you as a retailer?
Oh, you mean to be able to show the immunizations here? Well, I think there are a lot of people that maybe haven't experienced it or so forth that are coming over and getting their flu shots and so forth. But I think it just illustrates for everybody the role that pharmacists can play going forward. They're one of the most accessible healthcare professionals in the country. I don't want to go so far to say as they've been underutilized, because they haven't. They've played a very important role for years, and that's the safe and effective dispensing of medications, which if people stay adherent, it's the number one thing you can do to help control costs and improve health. But they can now do much more. And immunizations, vaccinations, screenings is a good example of that.
And NACDS as an organization as a whole, how, being a member of NACDS, what can you take away from the organization and implement into Walgreens? Well,
I think the association is certainly aligned with the membership. The membership is aligned with the association. In fact, that we are, NACDS's logo is the face of neighborhood healthcare. We talk about advancing the role of community pharmacy and healthcare. We all have our similar lines, so we're all trying to accomplish the same thing. The association has done a terrific job in taking a lead, for the industry, both with policymakers as well as the other stakeholders, the folks around here in this auditorium that are trying to help us do just that. So it's a great association. Steve and the team do a terrific job in helping us advance this great industry.
All right, and back to Walgreens, I think a lot of us want to know what other initiatives, what other trends can we expect from Walgreens over the next year or so?
Well, we are rolling out more and more services within our nurse practitioner clinics within our stores. I like to talk about how we're really co-locating additional healthcare professionals in our community pharmacies across the country. So in addition to trying to free up pharmacists to do more, we're bringing in nurse practitioners, in some cases physicians, in some of our community stores to offer extended services, acute care, cough, cold, ear, nose, and throat. We're expanding into chronic care management, so if someone has diabetes or asthma or some type of chronic condition, we're now able to treat them, working with the physicians. That's a big important point, is that community pharmacy, whether it's pharmacists or nurses, need to work in collaboration with the physician community as well. And I think there's just a lot that we can do to help gain access to care for folks all across the country.
Sure, really becoming a one-stop shop, right? Thank you so much, Greg, for your time. I appreciate it. And for NACDS-TV, I'm Sarah Solomon.